I'm a labor and delivery nurse. Here are the 5 things I tell my patients to avoid after they have a vaginal birth. 1. Don't ignore changes to the bleeding you're having down below. While we know your bleeding should be getting less and less as the days pass, if your bleeding suddenly is gushing or has big clots in it or is getting more watery or is getting brighter, if there are big changes happening, we need to let somebody know ASAP. 2. Don't put anything in the vagina for 6 weeks or until you see your provider postpartum. Tampons and fingers and other appendages that don't belong to you, or diva cups, nothing in the vagina after having a baby till you've been cleared to do so. 3. Please don't think that breastfeeding alone will prevent pregnancy. There's a little myth still floating around out there that if you're breastfeeding, you can't get pregnant, but that is not true. Which leads to number 4. Don't stop taking your prenatal vitamin after you have your baby. As a general rule of thumb, you're going to continue taking that prenatal vitamin, especially if you are breastfeeding. It's still providing you with lots of nutrients that you need to support your body postpartum. Also, if you do, have the sex and you do end up pregnant, hey, you are already taking that prenatal vitamin, which is really important, especially in early pregnancy. And 5, don't forget to check in on your mental health. We know that baby blues, they are expected after you have a baby, but many women report signs of postpartum depression and postpartum anxiety. So please, please, please check in with how you are feeling. Often make sure you are talking to your village and your support people about the changes that are going on in both your body and your mind. Did I miss anything? Follow for more.